Okay, let's think about it. You are working in the emergency room. Okay, imagine two patients coming in. One is bronze skinned, weak, and craving salt. The other has a round moon face, purple stretch marks, and high blood pressure. Both have adrenal gland problems, but in opposite directions. So, welcome to Nurse Ed Scholar. This is Tracy, and today we're going to break down Addison's disease versus Cushing syndrome. Stick with me because by the end of this video, you'll never mix them up again. Okay, so let's begin. All right, let's just talk about the adrenal gland. It sits on the top of each kidney and produces three major classes of hormones. You have cortisol, the stress hormone. It affects blood sugar. Remember that cortisol affects blood sugar, metabolism, and inflammation. The second hormone is aldosterone. It regulates sodium, potassium, and blood pressure. The third are your androgens, which are your sex hormones, but in smaller amounts. So when you're looking at Addison's disease, that means too little adrenal hormones. Cushing's disease means too much cortisol. So keep that in mind as we continue. So let's start off with Addison's disease, the slow and low disease, or low and slow disease. Okay, so Addison's is adrenal insufficiency. So think, like I said, low and slow. Now, what causes this? So Addison's disease is caused by an autoimmune destruction of the adrenal glands, which is the most common, and tuberculosis infection, adrenal hemorrhage, and long-term steroid withdrawal. So a person was on steroids and then they've been slowly withdrawing them, like they haven't been taking it, or the provider took them off of it, but long-term steroid withdrawal. So what are you going to see in this patient? You're going to see skin bronzing. So the adrenal corticotrophic hormone, which you'll see as ACTH, this hormone is produced by the pituitary gland, and it stimulates the adrenal gland to release cortisol. And so when this happens, melanin, oh my God, I'm sorry, I can't pronounce that. Melanin is produced. So the patient looks like they have a tan, but they didn't go to the beach, okay? So the next thing that you'll see with Addison's disease is hypotension, and that's from low aldosterone. So sodium and water are lost. You'll see hyponatremia and hyperkalemia. So in a person with Addison's disease, they're going to have high potassium and low sodium. They're going to have hypoglycemia, and that's due to low cortisol, because as we just learned, cortisol raises blood sugar. They're going to have salt cravings because the body desperately wants the sodium back because they're losing it, and so they want it back, so they're going to crave salt. And then they'll also complain of fatigue, weakness, and weight loss. So when you're thinking Addison's disease, think add sodium, add sugar, add steroids. Okay, that's Addison's disease. So now let's move on to Cushing syndrome, the high and puffy disease. So Cushing's is when there's too much cortisol. And this is caused by long-term steroid use, which is the most common. ACTH, that's that adrenal corticotrophic hormone secreting pituitary tumor. So Cushing's disease. So a person will have a tumor that's secreting the adrenal corticotrophic hormone and an adrenal tumor. So that's what's causing it. Patient has too much cortisol from those three things. The symptoms: a person will have a moon face, a round face, and a buffalo hump on their back. And this is because in Cushing's disease, the fat is redistributed. They'll have truncal obesity, so they'll be really large in the chest and the abdominal area, but they'll have thin arms and thin legs. So they'll have muscle wasting, but they'll have a large abdomen and chest. They'll have purple striae, which are purple stretch marks. The skin is going to be fragile, and that's from collagen breakdown. They'll have hyperglycemia because cortisol raises blood sugar. They're going to have hypertension because cortisol holds on to sodium and water. They're going to suffer from immunosuppression. So you may see frequent infections. They may come in with frequent infections. And then they'll also have osteoporosis, mood swings, and irritability. So when you're thinking Cushing's, think everything is round and puffy and elevated, okay? So when you're looking at them side by side, cortisol, Addison's going to be low, Cushing's going to be high. Aldosterone, Addison's it's going to be low, and in Cushing's it's sometimes going to be high. Blood pressure, Addison's low, Cushing's high. Blood sugar, Addison's it's going to be low, Cushing's it's going to be high. Sodium, in Addison's it's going to be low, Cushing's is going to be high. And potassium, Addison's is going to be high, Cushing's is going to be low. And their appearance in Addison's, like we said, they're going to have that bronze skin color and thin. And in Cushing's, they're going to have a moon face, buffalo hump, and those purple striae. So if you can remember, Addison is low and slow, Cushing's is high and cushy, I guess, because they're so large. Then hopefully that'll help you remember. So what kind of lab tests that the provider is going to prescribe for this patient? So for Addison's, they're going to order a cortisol level. So they're looking for low cortisol, and they're looking for high ACTH. And that's if the primary cause is because of the adrenal gland. They're going to also order an ACTH stimulation test. Now, don't worry, that's not going to raise the cortisol, but you'll look for those tests. Now, for Cushing's disease, they're going to do a cortisol level because they're looking for an elevated cortisol. They're going to perform a dexamethasone suppression test to hopefully show no suppression. And then they'll order a 24-hour urine cortisol, which would be elevated. So those are the diagnostic tests and lab tests you'll see. So here's where the good part is. As nurses, what are our interventions? And what are we going to see on NCLEX? And what kind of clinical questions will we see? So for Addison's disease, remember, give glucocorticoids like hydrocortisone and prednisone. We're going to give mineral corticoids like fludrocortisone for aldosterone replacement. We're going to educate that this is lifelong. This is a lifelong therapy. Now, the major thing that we're going to do as nurses when it comes to Addison's disease, we're going to watch for Addisonian crisis. The person's going to have severe hypotension, shock, triggered by stress or an abrupt medication withdrawal. This is a medical emergency, and we got to rush them in to give them IV steroids and IV fluids. Now, let's look at the nursing interventions for Cushing syndrome. So if it's from steroids, you're going to see orders to tell the patient to slowly taper the steroids, but never abruptly stop steroids. That's something that you're going to teach your patient, for them to never abruptly stop their steroids. But you'll teach them on how to taper slowly. If it's due to a tumor, you're going to prepare them for surgery or radiation. Okay. For Cushing syndrome, we're also going to control the hyperglycemia, hypertension, and infection risk. And we're going to provide emotional support, because understand the moon face and the humpback, they're going to have some body image changes. So we need to provide emotional support. So now, exam strategy. On exams and in clinical, we need to always think. For Addison's disease, we need to replace. For Cushing's disease, we need to reduce. So, quick recap. Addison's, low blood pressure, low sugar, low sodium, bronze skin, and fatigue. Cushing's, high blood pressure, high sugar, high fat deposits, round face, purple striae. And pretty much, hopefully that provided you a clear difference between Addison's disease and Cushing's disease. But I have a question for you. Which condition causes salt cravings? Addison's or Cushing's? Drop your answers in the comments so I know if you've locked it in. So with that, that's it. That's Addison's versus Cushing's. Thank you for watching NurseEdScholar. If this breakdown helped you, please hit that like button, subscribe, and share with a classmate who may be mixing these two up. But for more high-yield nursing content, it's on the way. So stay tuned. And welcome again to NurseEdScholar.